Thank you for joining us today. All members of the College of Dentistry family and others are welcome to this. And the purpose of this meeting is to follow up on a town hall we had March 16th. Boy, that seems like an awfully long time ago. And at that meeting, I think we just got some great questions from people, and we worked hard to try to sort through the questions, not only individually, what were the questions, but we tried to sort through what were the categories of the questions that we would need to respond to. And in the following days, we've tried to establish networks in all those areas so that we could keep people better informed through this whole crisis. So for things like education, patient care, HR issues, research, and so on. So I think we've worked hard at that. So today, what we'd like to do is have me talk briefly on this, and then what we'll do is have another Q&A session. And the purpose of the Q&A, two purposes. One is to try to address your individual questions, but also what we're trying to do now is to find out what are patterns of some of the questions that we're getting, just to see if things that we're working hard, anything is falling between the cracks. So today you can ask any question that you want. But I'd really like to start where we started the March 16th one, and one that we've talked about in different stressful situations and crises in past years. And that is, number one, we want to preserve our mission, and two, we want to protect our people, because what we need to do is do our best to keep the mission going, do our very best to give great education for our students, where possible for patient care, and also to make sure we're at where our research will continue. And then we want to protect our people. These are the ones that's the skilled workforce that makes it work. And I think we've done a great job over the years of trying to do both of those things, and we really need to do both. So today you can ask about anything, but certainly the main areas we focused on are education and student issues, patient care issues, research, HR, all the constituents at work we're working with, the university, UIHC, national, state, and so on, and then we'll try to look ahead. Let me take just a moment to back up a little bit. We are still in an unprecedented crisis. None of us can remember anything like this. And this is an international underestimation of both the contagiousness and the seriousness of this virus. Everybody is underestimating what will happen and have been slow to react. This is a virus that's sort of making its own rules. We've already watched CDC change some of their guidelines that have been around a long time. AAMC has made some changes in their guidelines, and so on. And the other thing is the speed of change. It's hard to believe that this virus was first found in China whenever it was November, or first reported in December, first in Seattle in January, and now here it is March, and it's already here. New York is facing major problems. How long is this going to last? We don't know. We don't know how long this will last. Certainly, I think we're hearing, and I'm not an expert in epidemiology, it is certainly not peaked. And you can pick estimates, whether it may peak in April, anytime through perhaps June, that it may peak in Iowa City. What we do know is that the longer it goes on, when we're trying to look ahead so that when the time comes, we can pick up the pieces and put them all back together again. And the longer this goes, the more difficult it is to figure out what those pieces are going to look like. So we're trying to adapt. So I think in the short term, we're really pretty well prepared in many ways, programmatically, financially, and so on, to withstand any kind of crisis. That's why we plan ahead. That's why we build reserves and do those sorts of things. What we've also tried to do is look out and see every practical scenario we can think of, and we welcome your input on trying to do that. But we've also tried to hold off on making decisions until we get closer, until we have to make the decisions, because things change so rapidly. I mean, if we look back 3 weeks and had tried to predict where we would be today, we would be completely off. So that means that what we're trying to do is look out as far as we had, think of all of the things that we can, and then we really tried to hold off until we had to make decisions, because things are changing so fast. So right now, as you know, the building is really in lockdown. The only people in the building now, we have our patient care group, and they've just done a phenomenal job. We have a person in the research area to watch the watch the freezers and so on. We have IT, who has just been invaluable through this whole thing. And so we've really got a skeleton crew keeping the whole thing through. And I just want to pause and thank the team, and that includes the leadership, that includes the faculty, that includes the students, that includes the staff, and even our patients who have pulled together through this crisis, and also our partners in the university, and also our partners at UIHC and partners around the state and nationally. I think the keys for this, one is to try to keep working together. And I think the next thing is to take all precautions to be safe. This is a public health issue. This is where it's completely different from the flood and the crash that we dealt with several years ago. This is a safety issue, and we have to keep people safe and do all possible. We do ask in any crisis that we communicate and try to do that, I think, in a way that that will keep communication open. I've made mistakes in this already. So if you see someone that's made a mistake, or you see someone you disagree with, please communicate with them in a way that will keep communications open. We keep getting the question, when will we reopen? Well, we're open for doing lectures, and the faculty have just done a great job. The students have done a great job in adapting to the new distance learning. We've had a few glitches, but overall, people have just really been successful in making sure that the instruction, the substantive instruction, continues on. The problem we have when we come to particularly the clinics, but also the simulation clinics where people would be in small groups, we really don't have really determinants on when we can come back. And that's really frustrating to everybody. They say, when will you come back? Well, the problem is we don't have things, if this happens, then we can come back. Or if that happens, then we can consider coming back. Right now, those determinants are still not there. And the college is not going to decide that on our own. I think we're going to see a lot of action in the next few weeks or so, but probably not tomorrow or the next day. So one thing I can promise you is this will bring disruption. It'll bring disruption in your professional lives. It already has. It's upset people's personal lives, vacations, family lives, everything. And as much as this has gone on, when we do get back, I can promise you it's going to take a lot of making up. And I don't know how that's going to happen exactly, but get ready, because it may involve weekends, it may involve evenings, all kinds of doubling up. And I think the team is trying to look ahead to see how that will happen. I want to thank everybody on the distance learning side. We rolled this out Monday, a week ahead of the university, with a few minor glitches. This is all going extremely well. And one thing, the learning is going very well. I know the whole university is struggling with the testing issue, and we're trying to work through on the testing issue. We do want to make sure that our seniors, our D4 students, are able to graduate. I think we're in good shape. I want to thank the whole family dentistry crew and the group leaders that have found creative ways to work with them to get them through, with not only the expectations, but accreditation does call for 4 years. We're working hard on licensing to make sure that's happened. Dean Canellis and his team have worked with that. So the challenges still remain the patient care areas and simulation. And because dentistry is at higher risk, we have people that are working at a foot or two, and there's aerosol. So those are things. On the patient care issue, as you know, we're still working and learning about the screening. I think elective care has been eliminated. As you know, we have rigorous screening. We're still learning about protective gear at the moment. We have enough protective gear for our people, but that, as you know, that's a national issue. Research, people are continuing in their continuity. In the HR issue, people who can work from home will work from home. And also I know people that don't have natural work at home can sign up and accept assignments. What we're seeing, just like with the flood, is people want to help, and people are signing up. I think there's still some things to work out with the connection between those two. So let me just look ahead for now. I think it's one day at a time. I think we're exploring scenarios, and I'll close with the same thing I opened with. Thank you to the team that did such a great job. I'm going to close by saying, everybody be safe. and please try to communicate and do it in a way that will keep communications open. Okay.